About every 3 minutes and 40 seconds, someone will have a stroke. It is the fifth leading cause of death, and the death rate here in Duval County tops the state average. So according to the Florida Department of Health, 55 out of 100,000 people in Duval County will die because of a stroke. That is 11 more than the state average. So that's why it's urgent that we have this conversation today. So joining us to discuss how we can bring down those numbers, a neurologist from Ascension St. Vincent's, Riverside, Dr. Adil Zia. You specialize in stroke care. Thank you for joining us today.
Oh, thank you for having me.
You know, I feel like we've been talking about heart and stroke for so long that it still always surprises me the amount of people who don't really understand what it looks like, the risk factors, you know, all the things that come down to something that can be so debilitating. So let's talk first about what is a stroke, what happens in the body when that occurs.
Very good question. Stroke is one of the more common neurological conditions. Nearly 800,000 Americans suffer from a stroke each year. As you've mentioned, it is one of the leading causes of death and disability. When it comes to stroke, there are two types. There's a stroke called ischemic stroke, which is caused by a clot. Clot forms in the blood vessel in the brain. It disrupts the blood flow. Blood naturally carries oxygen and nutrients to the brain, and therefore that tissue around that area ends up getting injured and causes a stroke. This is an ischemic stroke. The other type of stroke is called a hemorrhagic stroke, more commonly known as a bleeding stroke. In this case, the blood vessel ruptures or bursts open, causing blood around that tissue, and causes the same type of injury to the brain.
And that blood is always flowing to the heart, and it's needed for us to maintain our brain. And that's why when we talk about this, we talk about time, right? And how quickly you should get to the doctor if this does occur. So let's talk a little bit about that acronym that we all need to know, Be Fast. Why is that so important?
That is very true, yes. The sooner we can act, the better we can provide therapy, and the outcome tends to be better. Be Fast is an acronym we can remember as far as the signs and symptoms of stroke. B stands for balance, sudden loss of balance or sudden loss of coordination or unsteadiness. E stands for eyes, if there is sudden loss of vision in one eye or both eye. F stands for face, if there is droopiness of the face or numbness of the face. A stands for arm, weakness or numbness of the arm or even the leg. And S stands for speech, if someone is having difficulty expressing their speech, if the speech is coming out slurred, or even comprehending speech is a problem. That's a sign of stroke. And finally, T is for time. Time to call 911, seek medical attention. We emphasize the phrase time is brain because the sooner we can apply and provide therapy, the better the outcome tends to be.
These are not things to play with. I mean, I think that people may shrug it off and say, oh, it's not this, it's something else, but those are not associated necessarily with other conditions. So if all of those things or any of those things start to happen, you need to call the doctor.
That's correct, yes. You need to call the 911, seek medical attention, because we have a limited amount of time where we can provide some therapies, and they're time dependent, and we see the sooner we can apply and provide these therapies, the better the outcome tends to be.
And just finally, to be proactive about this, what are some of the risk factors that people need to watch out for?
Well, when it comes to risk factors, there are modifiable and non-modifiable risk factors. So modifiable risk factors are factors we can control, such as high blood pressure, diabetes, cholesterol, tobacco smoking, alcohol use, excessive alcohol use. So by optimizing these risk factors or eliminating these risk factors, one may minimize the risk for having a stroke. The non-modifiable risk factors are certain things such as age, sex, race, genetic makeup, family history.
Can't do anything about that.
Those are a little harder to control.
But the others you can monitor and starting your entire life,
That's correct.
Just living a healthy life. All right, thank you so much for coming in.
No problem. Thank
Take
you for
this serious,
us.
folks. I mean, this is things that they affect so many people in our community. So the more that we know, the better our health will be collectively.